Welcome to Week 6, Part 2 of the DPS NCLEX Success Track. In this session, we focus on physiological adaptation and collapse response. Unlike Part 1, where we identified early deterioration, this section addresses what to do after the patient has already significantly worsened or collapsed. This is a core area tested on the NCLEX and NGN. The purpose of Part 2 is to prepare you to manage patients after major deterioration has occurred. At this stage, the patient is unstable, and the nurse's role shifts from monitoring to immediate stabilization. NCLEX expects decisive action, not delay. The purpose of Part 2 is to prepare you to manage patients after major deterioration has occurred. At this stage, the patient is unstable, and the nurse's role shifts from monitoring to immediate stabilization. NCLEX expects decisive action, not delay. Shock represents a failure of adequate tissue perfusion. The NCLEX commonly tests four types: hypovolemic, septic, cardiogenic, and anaphylactic shock. Although causes differ, the nursing goal is the same: restore perfusion and oxygenation. In shock, the nurse must treat the underlying cause, not just the blood pressure. Raising the blood pressure without correcting the cause will not save the patient. This concept appears frequently on the NCLEX. Acute respiratory failure occurs when oxygenation or ventilation is inadequate. Early signs include tachypnea and restlessness, while late signs include cyanosis and bradycardia. The nurse's immediate priority is airway maintenance and oxygen delivery. Acute kidney injury often develops during shock or severe illness. Key indicators include decreased urine output and rising BUN and creatinine levels. The NCLEX emphasizes urine output as an early and critical indicator of renal perfusion. Neurological collapse is often indicated by changes in level of consciousness. Early signs include headache and altered mental status. Late signs include Cushing's triad, which indicates dangerously increased intracranial pressure. Early recognition is essential. When one organ system fails, others often follow. This is known as multi-organ dysfunction syndrome. In these cases, the nurse must support the most immediately life-threatening system first, usually the airway or circulation. At this stage of clinical judgment, the nurse takes action. This includes initiating emergency interventions, collaborating with the healthcare team, and closely monitoring the patient's response. NGN places heavy emphasis on active intervention. Remember these key NCLEX principles. Collapse always follows deterioration. Stabilization must occur before teaching. And reassessment is never optional, it is required after every intervention. These rules will guide you through most NGN collapse scenarios. Let's start with this question. Which finding most strongly indicates septic shock? As you review the options, think about whether the question is asking for early or late shock findings. Remember, the NCLEX often tests early sepsis, not the final collapse. Which finding most strongly indicates septic shock? A. Cool, clammy skin and hypotension. B. Warm skin, tachycardia, confusion. C. Bradycardia and decreased respirations. D. Narrow pulse pressure with hypertension. The correct answer is B. Warm skin, tachycardia, and confusion. In early septic shock, vasodilation causes warm skin. Hypotension is a late finding, so if you wait for low blood pressure, you are already too late. A patient is in hypovolemic shock from GI bleeding. What is the priority nursing action? A. Administer vasopressors. B. Prepare for blood transfusion. C. Maintain airway and give oxygen. D. Obtain a detailed health history. In early septic shock, vasodilation causes warm skin. Hypotension is a late finding, so if you wait for low blood pressure, you are already too late. The correct answer is C. Maintain the airway and administer oxygen. No matter the type of shock, ABCs always come first. Blood products and medications come after airway and oxygenation are secured. Which assessment finding is an early indicator of acute respiratory failure? A. Cyanosis. B. Bradypnea. C. Restlessness. D. Decreased PaO2 on ABG. This question asks for the earliest indicator of acute respiratory failure. Several options are late signs. Be careful. The correct answer is C. Restlessness. Restlessness is often the first sign of hypoxia. Cyanosis and bradypnea appear much later and signal severe deterioration. Which finding is most concerning for acute kidney injury? A. B. U. N18 mgdl. B. Urine output 20 mLhr. C. Potassium 4.5 meql. D. Clear lung sounds. Here, the question focuses on early recognition of acute kidney injury. Which finding best reflects decreased renal perfusion? The correct answer is B. Urine output of 20 milliliters per hour. On the NCLEX, urine output is a faster and more reliable indicator of kidney perfusion than lab values. Less than 30 milliliters per hour is always concerning. Which finding suggests increased intracranial pressure ICP? A. Tachycardia. B. Restlessness. C. Widened pulse pressure. D. Bradycardia and hypertension. This question is testing your knowledge of increased intracranial pressure. Which finding represents a late and dangerous sign? The correct answer is D. Bradycardia with hypertension. This is part of Cushing's triad, which indicates severe increased ICP. The NCLEX expects you to recognize that this is a medical emergency. A patient with sepsis develops respiratory failure and AKI. What should the nurse focus on first? A. Renal replacement therapy. B. Supporting the most life-threatening system. C. Educating family members. D. Documenting changes. This patient has sepsis with respiratory failure and acute kidney injury. What should the nurse focus on first? The correct answer is B. Supporting the most life-threatening system. In multi-organ failure, you cannot fix everything at once. You must stabilize what will kill the patient first, usually the airway or circulation. After initiating oxygen and IV fluids for shock, what is the nurse's next priority? A. Administer PRN medications. B. Reassess vital signs in response. C. Prepare discharge teaching. D. Reduce IV fluids. After initiating oxygen and IV fluids, what should the nurse do next? Think about the NGN clinical judgment model. The correct answer is B. Reassess vital signs and patient response. On NGN, every intervention must be followed by reassessment. Intervention without evaluation is incomplete care. Which patient should the nurse see first? A. Stable CHF patient with ankle edema. B. Post-op patient requesting pain medication. C. Septic patient with increasing oxygen needs. D. Diabetic patient with glucose 240 mgdl. This is a classic prioritization question. Which patient should the nurse see first? The correct answer is C. The septic patient with increasing oxygen needs. Always remember unstable comes before stable, and respiratory compromise is always a priority. Which finding suggests compensation is failing? A. Tachycardia with normal BP. B. Increased respiratory rate. C. Hypotension with altered lock. D. Warm skin. This question asks when compensation is no longer working. Which finding shows that the patient is now collapsing? The correct answer is C. Hypotension with altered mental status. Once blood pressure drops and mental status changes, compensation has failed. This is no longer early deterioration, this is collapse. Which action demonstrates safe nursing practice in acute collapse? A. Waiting for provider orders. B. Completing documentation first. C. Activating rapid response. D. Reassuring the patient only. This final question focuses on patient safety. Which action demonstrates safe nursing practice during acute collapse? The correct answer is C. Activating the rapid response team. These quiz questions highlight the most important message of Week 6 Part 2. When a patient has collapsed, the nurse must act quickly, prioritize life-threatening problems, and reassess continuously. This is exactly the level of thinking NCLEX and NGN expect from a licensed nurse. NCLEX rewards early escalation. Waiting, documenting, or reassuring alone is unsafe in a collapsing patient. In summary, Part 2 focuses on how nurses respond when deterioration has progressed to collapse. Together with Part 1, you now have a complete framework for recognizing danger early and responding effectively when it occurs.